How many people here have been to a hospital? Okay, a fair amount. How many people here have been to a hospital and when they were walking up or were outside, they saw a medical staff or hospital employee smoking? So a substantial amount. Did you know that over 45.3 million people over the age of 19 smoke tobacco products? And according to the AmericanNurse.org, over 10% of that number is people in the medical field. So that's a lot of people in the medical field who smoke tobacco. Today I'm going to be sharing with you why medical staff smoking is a problem, what hospitals can do to help, and how you can get involved. The problem is, too many people accept unhealthy lifestyle habits for people in a line of work that makes them a role model for citizens. Doctors and nurses are the people who know the most about what's good and bad for our bodies because they've had the most education on it. When a normal citizen, someone who hasn't had that education, sees a doctor or a nurse outside smoking, they may take all the information that they previously learned about smoking and throw that out the window, because when we see someone who's educated smoking, we think, well, they've had the education, they know what's good and bad, and obviously it must not be that bad if they're doing it. The Institute of Public Health in Denmark actually did a study on this. They surveyed over 1,000 people in the medical field and patients and asked questions regarding what the influence of medical staff smoking had on them was. This was their findings, end quote, individual smoking habits among hospital staff strongly influence smoking-related knowledge. So it has actually been proven that this has an impact on people's opinion over smoking. How can the hospital correct this problem? The hospital should implement a strict nicotine testing program for all of its staff. Random nicotine urine tests should be given every month and to anyone before they are hired. This is an example of a nicotine urine test, and urine tests are much more accurate at reading the results. This should be mandatory for everyone, and it should be on a 3 strikes you're out rule. The first time you fail a nicotine urine test, you'll get a verbal reprimand. The second month you fail a nicotine urine test, you will have it put on your record and receive another reprimand. And then the third time you fail a nicotine urine test, you will be put on a probationary period and then have 30 days to get yourself together and pass the test. Now, this will help set better examples for the community and for patients and hospitals. This will help reduce the exposure to secondhand smoke, and hospitals can help their employees quit smoking easier by providing counseling, nicotine patches, and gum by partnering with the Tobacco Free Florida, which already provides free help to anyone who lives in Florida and that needs help quitting. Now, let's take a moment and visualize what it would be like for hospitals and medical offices to be smoke-free. If we adopt the nicotine urine test, people will be healthier and happier, and we need those people to be healthy and happy because when we get sick, there's not much we can do about it. We don't have that education. We need them to be strong and healthy in order to keep society healthy and strong. If we do not adopt these, the insurance costs will continue to raise. As you can see, smoking is very expensive for hospitals. For reduced productivity, it costs the hospitals $462 per year, which is not that much when you think about how much they make. But per year, it costs every hospital $3,000 just in smoke breaks. Tobacco Free Florida states that 20 minutes after you quit smoking, your blood pressure decreases. 8 hours after you quit, your blood oxygen level returns to normal. 3 months after you quit, your lung function improves up to 30%. And then 1 year after you quit, your risk of heart attack is reduced by 50%. That's pretty substantial. So I'd say that we definitely should adopt these procedures. Now, you may be thinking, what can you do to get involved? There is something you can do. NoSmoke.org is an organization that has been funded. It's called the Americans for Non-Smokers' Rights, and it helps educate the population and also helps educate different businesses in your area on the benefits of being a non-smoking business and the benefits of helping their employees quit. Even by donating $1, you can help this organization raise awareness and help get businesses moved onto a non-smoking platform.